become family. Just as long as you can take my hand.
All right, welcome back to The Link. Good morning, it's 7:04.
Tropical treasure.
Monday.
Maybe Tomas can do an Instagram story with all the stuff we talk about during commercial break.
Yeah, that's kind of like the real show, honest.
The play within the play.
Right, 7:05.
Soliloquy.
It's The Link, Pacific Points, Cabo Enterprises, ITD, and Jack in the Box. Let's bring back an old friend of containing COVID and The Link, Dr. Peter Lombard, crunching COVID stats. You know, we were bringing him on, obviously, during the height of the pandemic, and unfortunately, a lot of his forecasting and data was really on point. But I say unfortunately because he was just predicting a lot of the deaths that we saw in the latter part of the year last year. So every time we'd have him on, Bree would be like, I don't know if I want to do this right now. I don't know if I'm ready. And I mean, we're laughing about it now because that's just a coping mechanism. But yeah, it was crazy, Doc, because you
on point.
You were right. And so here we are. What is this week? This is week 7, right, of this surge?
Yeah.
Week 7 of this surge. Yeah. And I can't believe I forgot to give you a ring this whole time. And it hit me last week when we had Dr. Ann on. I was like, hey, there's someone else that does charts and graphs and is pretty good at it too, Dr. Peter Lombard. So welcome back. And we know that you've been pretty busy, so we're going to go ahead and give you the floor. And if you want to just share what you got with us this morning, then we'll ask you a bunch of tough questions.
Awesome. Thank you. And I have quite a few slides. I'll try to get them quickly, but please feel free to jump in and stop me, ask questions along the way. I think that's more important than just getting through everything. But you have the slideshow up?
Yep, good to go.
Okay. Well, where are we now? And I'm not personally tracking the data anymore. It was a little bit cumbersome and difficult to get the data that I thought was interesting. So thank you, Chris, for telling me about Dr. Pavetsky's presentation. I really enjoyed watching her slides, and I've actually screenshotted a few of them because I think they're worth talking about a little bit more. But here's where we are. This is the United States. You can see in September of last year, we were the worst state in the nation, and we did much better along the way, while the rest of the nation had a big surge in December, January. We did fairly well through the summer, and so recently we're one of the worst states in the nation again. And if you look at on the y-axis, we're at about 100 cases per 100,000 people. I think it's probably a little bit more than that now, as we're seeing, numbers in the 200s fairly regularly, close to 200 a day last week. If you compare us to on the global scale, these are all the countries in the world. 100 is right where I put Guam here on the right. So even worldwide, we're one of the worst in terms of the number of cases per capita. We're one of the worst places for COVID right now. It was interesting to see among these countries that are doing the worst, there were quite a few island nations, and I don't know if that there's something more to that. Maybe there's something about being on an island with the Delta wave that makes it a little bit more difficult to control. That was a little bit reassuring to me. You can see St. Lucia, Seychelles, even down in this area here, St. Kitts, so a lot of islands in the Bahamas, in the Caribbean. So, but it is interesting to see where we are, and perhaps even a little bit comforting. It's bad that we're there, but you don't see many other countries doing much worse, so maybe that means this is the worst of it. That's the only silver lining I can find there. But it does feel a bit like Groundhog Day. We've been through this before, and now we have to figure out how many restrictions are we willing to put on ourselves to try to keep this under control and stop our health hospitals from getting overfilled. So the tough question is, I'm going to try to address today, why is this happening? What should we do about our schools? Are we able to keep our kids safe? And so many questions about the vaccine. Why are we seeing so many fully vaccinated cases and admissions? What is the efficacy of the vaccine against the Delta variant? And what's the deal with the booster shot? So here's a screenshot of Dr. Pavetsky's. This is her data through August, and this is the one that showed hospitalizations and ICU. I was really a little sad to see it stop on August 31st because the last week or so has been even more dramatic, I think. And I try to keep the scale. So 40 here, 80 would be about up here on the left. We're at 76 at least through the weekend. We didn't have the Naval Hospital data, so it might be around this area. But this is how high these bars would extend if the data were more current. But curiously, the ICU is still fairly flat, which is fantastic, and that's one of the bright spots here in what's happening. So why is this happening? I mean, I think public health has, I'll call them challenges. I think I was pretty honest. I didn't expect a Delta surge like this, and I bet you not many experts even really did.
Yeah.
The Delta is it's just a force, and it's so transmittable. Thankfully, not necessarily more virulent in terms of how sick it makes you, but it is tremendously more transmittable to a level that nobody really had expected. The only good thing about that, by the way, is that it's so transmittable that even if there's a variant like the Mu variant you might have heard of that is more resistant to the vaccines, the Mu can't outcompete the Delta variant to transmit to people. So it probably won't ever be a real issue. So I thought that was an interesting thing that I read about the other day. So public health, I think everybody is frustrated, especially in our community. The contact tracing, but I know the public sees this too. You're positive, you test positive, you just can't get any information. When can I go to work? When are my children okay? When am I cleared? How do I get an official notification? And a lot of patients are calling the doctors and asking them, and we're giving them the best advice we can. So I think that the whole contact tracing, it feels like it's maybe non-existent or
Yeah.
just they just maybe even thrown their hands up and said forget about it. And
Doc,
I read in Texas that they've officially said we're not contact tracing anymore. So I don't know what's better.
Yeah.
Just to say we're going to focus on other things, or to say we're still trying our best, and we'll do what we can for the clusters or something like that.
Doc, let me get in. Sorry, we had Chima on. I want to say it was a couple weeks ago, and he had come on and he said the pivot with public health was, you're right, that the COVID, it's just everywhere. It's rampant. It's widespread in the community. And so he said, contact tracing is kind of pointless at this point. So the pivot was, they're telling everyone to go get tested. And if you test positive, then you're supposed to notify everyone you've had close contact with to go get tested. And so that's presented. And you mentioned challenges. One of the challenges is if you go to tell everyone to get tested, then you're going to have people going to get tested, and what we've seen is a huge backup over here at Tizen. And
I wish the messaging was a little bit better or more public. I think there's a lot of people that don't know that that's official. Maybe they don't want to be that open about it, but if that's what they're truly doing, I think people need to know that, and they need to provide us with very clear, easy resources about so every person that knows exactly what to do if they were a close contact. The testing is I think we're doing a decent job of testing. The question is what kind of tests are we using, and I don't have a whole lot of data on that. Getting the data out. I mean, again, this presentation from Dr. Babetsky was great. I do wish it was a little bit more current, and this is the kind of stuff that I love to see, and I think a lot of people it would really help them to understand what's happening if we were able to see this kind of data a little bit more regularly or on our dashboard. There are mitigating factors here with what's happening. The hospitalizations this time around are spread out amongst the three hospitals a bit more, including amongst the three ICUs. So that's a change from last year. So I don't feel like we're quite at the point where we need to ration care at any one of the hospitals. And remarkably, our ICUs and our vent rates are exceedingly low, and that's due to the vaccine. Our cases are very, very likely to be undercounted by a wide margin. So you can look at our test positivity. The higher test positivity, the more cases you're missing. Okay, some mild symptoms or no symptoms. And so there was a formula that I was using, and if I apply that formula to our test positivity and our numbers, let's say 200 cases in a day, the true cases are probably something more like 1,500. So just to give you an idea of how much more likely this is out there in the community, and why, again, contact tracing is almost a fool's errand to try to even try to tackle. Now, if we were not 70% population vaccinated right now, that's an approximation, but we would be seeing, like you alluded to before, many, multiple times worse than we are now. And I can say that, but if people don't believe that, I don't know what else to do. If we were all unvaccinated right now, things would be looking a lot worse. And this is, again, because of the Delta. If we didn't suppress the surge last year where we did with the Alpha variant or the earlier variants, we would have been training on, a trajectory which saw us hit maybe close to 150 deaths by the end of the year. But things came down, and we were able to get through a number of months. But now with the Delta variant, thank goodness, we did flatten the curve early on, and now we're dealing with something new that not many people expected or had anticipated.
Doc, this
So
is
next-
if we could,
Yeah.
before we move on, we asked this question to Dr. Pobutsky about a lockdown, right? Because just people have it in their head that that's what worked last time, and if we're in this situation we are now, even with the vaccines, people feel that the restrictions that are currently in place aren't doing anything, and I would agree to lower the case count. So we had a comment here. Does Doc feel that a lockdown is needed to stem the spread?
I think it would. I mean, I don't think it's needed per se. I'm being optimistic here, but I do think that we're going to start to see a downturn. I've been wrong about that before. Even a month ago, I would have thought that we were starting to plateau. So, but I at this point, you've seen a few efforts by the governor 2 weeks ago to try to slow things down, and it really didn't do anything. And I think it would have to be a really dramatic lockdown, and again, the public backlash would be severe. And if our numbers are starting to trend down, which I think we'll hopefully start to see over the next week, then I would suggest that we don't have to do something that significant, given that our ICUs are okay and our cases, although our hospitalizations are spread out over 3 hospitals. So we're not rationing care like they are in some states. Idaho, I've heard Arkansas, ICU level care, people that need routine procedures, tumor resections, that they can't get their care now because their hospitals are so full. I started for the blur here. This is another slide that I took from Dr. Pobutsky, where she showed the age groups. And I do want to highlight this because I think it's very important for people to understand. It is absolutely true that the age group of 0 to 31 is driving the surge. There's no question that that's what's happening. And it's the least vaccinated age group as well. So the only good things about this is that, these are healthier people. They're going to have better outcomes. And once they're exposed and naturally immune, they've got pretty darn strong immunity to future exposures. But the cons is that it's making this a lot harder for the rest of us, and especially those that are in the older age groups that have comorbidities, that are at higher risk of having a breakthrough infection that is serious, because it can happen, especially the longer that we've been vaccinated because of the waning immunity. So I wanted to make sure I highlighted that's very important. This one is the one that shows the vaccinated versus unvaccinated cases. And you can see, so the orange is the unvaxxed, blue is vaccinated cases. And this is cool because I never seen anything like this. And you can kind of look at the JIC report and get an idea of how many hospitalizations. But the JIC report the cases looks to be pretty similar. We're going anywhere from between a third to a half of all of our cases are people that are vaccinated. Okay, so at least through August. And I'm talking to Dr. Nguyen, and he just kind of anecdotally shares with what's happening in their clinic. It's a lot higher at his clinic, apparently. He's maybe even seeing 70%, 80% some days of all the positive tests being in fully vaccinated people. So I was kind of glad to see, if you look at all comers and you're incorporating the testing that's happening at public health and other places, it's not that bad. But at the same time, I also think it's really important to start the messaging. This is normal and expected for this percentage to continue to increase, that the percent that are vaccinated of the total is going to keep getting higher and higher the more people are vaccinated. And I have to be really, I want to be urgent in that message. I don't want people to look at that as a failure of the vaccination. I mean, on one extreme, imagine 100% of Guam is vaccinated. Then whatever cases we see are breakthrough cases, and 100% of them are going to be from vaccinated people. So this percentage is going to keep going up higher and higher the more people that are vaccinated. This is something that I made a little infographic. I was proud of myself. There's an app that let me do this, but this is the hospitalization from Friday, a little infographic here. So about 38% of our admissions, and we don't know 3 of them, the vaccination status. And I think a lot of people are looking at this and are saying, what's going on here? And again, this goes back to the last point. The curious thing about this is why in Guam but not necessarily in Hawaii or really any other state. And I've been really looking at this data more than anything over the last 2 to 3 weeks, because our numbers have been 30-40% for a week or two now, and I'm not seeing it very many other places, but we are seeing it in some places, just not necessarily in the United States. In fact, in the UK, recent data, 30 to 50% of hospitalizations are fully vaccinated. In Israel, 1/2 to 2/3 of severe cases are fully vaccinated. In Iceland, 50 to 70% fully vaccinated. Singapore, 60%. So we're not completely alone. And what do all these places have in common? Very high vaccination rates. These are very well vaccinated countries. Okay, so it's again, what I don't understand yet is why there's states that are very well vaccinated that still aren't showing the same thing. But I think there's reasons for it, and mostly related to how early we got a lot of vaccine in Guam, and how many people. I think we had a lot of people vaccinated in December, January, compared to most of the other states. And I think you guys, if you remember, we were very proud of ourselves for getting so much vaccine on island, and we were able to push those out to the point where we're worried about running out. I think that's probably the biggest reason why there's a difference between Guam and the rest of the United States when it comes to this percentage.
So let me just cut in. So basically what you're saying is because we vaccinated such a big chunk of our population, and mind you guys, remember who we vaccinated first? It was the frontline workers and the Manamko, right? The elderly. Because we vaccinated so many people at the onset, that the protection that we got with the vaccine is fading right along with everyone else who administered a lot of shots early.
That's right. That's right. So, and this is all ties into the waning immunity, which I think is an important thing to talk about now. So this is Israeli data again. Israel is one of the if not the best country in terms of early vaccination and vaccinating a lot of their people. So if you look here on this 60 plus bar graph here, these are infections that were documented from July, the latter half of July. If you had your vaccination in January, this is how many people per capita got COVID in July. And this is if you got your vaccination in February, March, April, May. So you can see how once you get to 6 months vaccinated, your risk of getting COVID is much higher than if you're just 1 or 2 months vaccinated. And guess what? We're at like 8 or 9 months now for some of the earliest people here. And this is only showing 6 months of data. So now here's the good news. Even with waning immunity, even at 6 months, you're still 5 to 6 times less likely to be hospitalized than if you're unvaccinated. It used to be 10 to 20 times more better protection, but even with that 10 to 20 times decrease in protection, you're still many magnitudes less likely to be hospitalized if you're vaccinated with the waning immunity. So this is another screenshot from Dr. Ann. This is the one, and this one is super blurry. I just couldn't get this to clear up anymore. This is the ethnicity one. Remember, she was saying how the Chamorro ethnic group is responsible for the most of the. And I don't know if she's watching, but if she can, hopefully she can check my numbers here. I think this is Chamorros, and then Chuukis, Filipinos here, and then Caucasians here. So it is absolutely true. But if you look at the total numbers, absolutely that most of the cases are in Chamorros. But then, you got to think a little bit further and say, well, what is the proportion of Chamorros in the population? Well, we know it's about 37, 38%, right? Well, I did my best to try to estimate what these numbers are, and I added up all of the blue bars. So all of the unvaccinated infections from December to August 30th, and I got about 2320, and I was just trying to eyeball it. And if you look at, this is about 780 Chamorros out of that 2,320, and it's about 33%. So I think proportionally to the island's, natural, ethnic diversity, I actually don't think it's unusual to see this number. And I hope she can double check this for me and tell me if it's accurate or not. But I don't think, at least from the way I look at this, the messaging is it's all your fault because just because you're unvaccinated. I mean, if there are a lot, I've heard 50% Chamorros are not vaccinated. That's certainly playing a role, but it's not proportionally different than what our normal mix is for the population. So moving on to schools, closure two weeks ago. I think it's still kind of early for it to have had any real effect. If it has, it's been very marginal. And as you can see, the numbers have continued to increase. So obviously it didn't really I think it's clear that the community transmission is driving our surge right now. So it would have been nice to see some more recent data, really within the last week, I think, about what is the proportion of the cases that are in school-age kids versus the 18 to 30 group. If a lot of those were in the younger school-age groups, then you might say, okay, the schools being open for that period of time had a big impact, and maybe we'd even start to see some changes in that proportion. Where do we stand? These are questions I have. I mean, I don't know, who has this information, but how is mask use and physical distancing being enforced in the schools? What is the classroom ventilation? And is it different from school to school, classroom to classroom? Is there somebody that goes and looks and offers suggestions and helps people build even makeshift ventilation devices that can assist? Do we have surveillance testing? I don't know the answer to that. I don't think so. But some of the school systems that have done a really nice job of staying open and safe have surveillance testing. They'll test an entire classroom once a week. It's not perfect. Obviously it's gonna miss some cases, but it's one more piece of the puzzle that makes a difference. The other strategy I've seen is having a dedicated contact tracing mechanism for kids. I saw in San Francisco, they outsourced this to an organization. They pay for it. I mean, sure, it's expensive, but if a kid has either close contact or is positive, they contact this separate group, so they don't have to deal with the public health, drama, and they're obviously completely overwhelmed. So they have this dedicated resource they can go to that gives them the advice that they need. Do we have to do school closures, all the way across the board, or can you selectively close schools? I know that's a little bit loaded. Public schools maybe have a bit more resources to be able to devote to this, and maybe their cases are lower. Is that fair necessarily? But maybe even not selected schools, but selected grade levels or classrooms where you're seeing outbreaks. Is that better than closing schools completely? So obviously, even with open schools, we still have to close things down temporarily. Whole classrooms have to be quarantined. And obviously, this is very disruptive to parents as well too. Now, when it comes to the question of school, I have to say I'm extremely torn. Okay, there are real harms to not allowing kids to be in face-to-face schooling. This is some data about kids falling behind. Okay, so in relationship to historical test scores, this is the decrease in test scores. So amongst students of color, reading K through 5, 77% compared to where there would have been at 100%. White students at 90%. So you can see the disproportional effect of being a person of color or a child of color. But look at even all the way down to math. Look how much math is suffering because of school closures. So these are real things, and I don't know. Are we going to be able to catch up? And a lot of these especially if you're in a low-income group where education is everything, we keep encouraging our kids to get the education so you can go and move on to that next thing. How much is this year or two of not being in person going to affect them for the rest of their life? And it's important. I don't know, relative to kids dying of COVID, relative to a lot of these other harms that can happen. 1 million primary caregivers have died from COVID. I mean, I have to think that if I was a child, having a primary caregiver die is going to be way more impactful than being home from school for a year.
Yeah.
I mean, so, these are competing interests, and 400 kids have died of COVID to date. About, if we had 1 or 2 children in Guam die, that's a big deal, I think. And I think most people do too, but other people wouldn't necessarily think so. They say, well, we're in a pandemic, guys. This is part of what's going to happen. We got to take care of the other kids too. I'm sorry that happened. So these are questions I think everybody's going to feel a little bit differently about. But I wanted to make sure I highlighted the fact that there are absolute harms with keeping kids out of school.
Right. Yeah. No, I mean, in 20 years, we're going to be dealing with these whole generations of people who the last couple years, right? And people are like, hey, what's wrong with them? Oh, they're a COVID kid. Yeah, they didn't have masks for 2 years.
Yeah, I wouldn't be surprised if we see some kids that are named Delta this year either.
Oh no. No.
So can schools be reopened safely? This is San Francisco data. This is when their schools open, and these are the groups of kids, school age kids up to 18 in the pink here. The elementary schools are down here, and their cases are continuing to decrease. So it is possible. It is absolutely possible to open schools and keep the numbers down amongst the classrooms. There are some caveats. Well, they are pretty close to where we are in Guam in terms of total vaccinated. 90% of their kids that are 11 to 6, I'm sorry, that should be 12 to 16 are vaccinated. Of eligible kids are vaccinated. They do a great job with masking, and they have this surveillance testing and dedicated contact tracing. But they're notably not dealing with the surge in the community like we are. So I think there are some caveats there. But I think it is important for people to know that it is possible. It is possible to keep schools open. But whether or not we have the resources to be able to do so safely, that's another question. The American Academy of Pediatrics, everybody needs to know this too. We should start with the goal of keeping students safe and physically present in school. This is their official position. They want, if whatever you have to do to make it safe, keep the kids in school, because they're seeing the harms of keeping kids out of school. So it just makes things more complicated for us here. This is a recent morbidity and mortality report from the CDC, and this shows us the key points here. Moderna is, with this waning immunity and immunity against Delta, it looks like Moderna is a little bit better than Pfizer, and both are better than Johnson & Johnson by a fair amount, but all of them are better than being unvaccinated against Delta. This is specifically against Delta, because this is only cases from June to August in 9 states. We know this is Delta. So I think there's a little bit of a difference between the two mRNAs. I think there's possibly some reasons for that. We know that the Moderna dose is a little bit higher. Pfizer chose a lesser dose, hopefully to decrease the side effects. And you might have heard this too, but the 3-week spacing versus the 4-week spacing, that might actually be pretty critical in terms of a more robust response to the second dose. And even in England, they have been forcing people to wait 2 to 3 months, because they know that the immune response, if you wait longer for the second dose, is going to be higher. And that's why I think maybe England is doing a little bit better than Israel, for example. Israel kept the 3-week dosing. So the dose and timing might be responsible for the little bit of difference between Moderna and Pfizer. But again, the key point here, they're all still working against Delta compared to being unvaccinated, even with waning immunity. This is real preliminary data on the booster. Okay, so people, how effective is this booster? These are people here in this group of cohorts, no booster, and these are people here with the booster, and this is the number of cases that we're seeing now. So it's extremely protective to get the booster shot. Now, of course, we don't know how long it's going to last, and this is part of the ongoing issue with this novel coronavirus. And these new vaccines, there's still things we're learning every day. I think there's good reason to believe and to hope that this one booster is going to last a long time, and we won't have to keep going back for boosters every few months. So again, coming back to our initial questions, why is this happening? I think we definitely have waning immunity. We vaccinated ourselves well and very early. We have a lot fewer restrictions out there. I think there are also some super spreader cluster events, which I've heard about anecdotally, that I think are probably maybe the most important reason why we have such a surge right now on an island. Public health has had its challenges, and the high proportion of new cases and hospitalizations being fully vaccinated is not unique to Guam. People need to know that, and expected to continue to increase the more people we have vaccinated. Can we keep our kids safe? I think the goal should be to open our schools if we can. We need to give the schools more resources. Maybe some of that extra pot of money that they're spending on tourism, maybe consider using that for the schools, because I think that should be a big priority for us. We do have to get our economy going. I get that, but let's not forget about the kids either. Yes, the vaccine is still efficacious against Delta, even 6 to 8 months, even without the booster, but the booster will help significantly. I'd say do it for the kids, but I think for people that are anti-vaccine, I don't even think that's going to really resonate with them, because they're going to say kids do so well against it. It's like, sure, you're seeing more cases in the kids, but they're all going to do fine. This is, again, you either believe the data or you don't. I think that's some of the problem. You can show them the same data, and they just don't believe it. They think there's reasons why, that's why, there's different reasons. Those aren't true cases and this and that. So I don't know what to say. If you don't believe the data, then I guess that's where the conversation has to stop, I guess.
There's so many different schools of and I don't like calling it anti-vax, because you got some people don't want to take it because they're health conscious or whatever, and they're vegan, and they don't, you know what I mean? They just don't do that kind of thing. Then you got the other people who are like, it's a government conspiracy. Then you got the other people who are like, we don't have enough data on whether or not it's safe, and we should have have an informed choice, right? So it's definitely,
Yeah, that's true. There are many reasons, and the vocal folks that have a lot of questions and concerns or are not swayed yet, they're very influential. And I think that it's the classic, you're in an echo chamber where you're only talking to people who think like you.
Yeah.
And I don't know, I think you really need to go to the hospitals. If you don't believe that these hospitalizations are from COVID, prove it by going to the hospital, look at these cases that are being admitted and see what kind of illnesses there. There's even people in the hospital that don't think they have COVID. They think it's something else, and so how do you combat that? I don't know. Now, this last graph here just shows that these are all the states. This is the percent vaccinated in the states on the x-axis, and these are the hospitalization numbers for kids. And so you can clearly see the trend here. The more vaccinated people you have in your state, the less pediatric hospitalizations you're going to have. Again, we thankfully don't have a lot of kids that have died from this, but we're going to continue to see more in low numbers, and that is a big tragedy. So my optimistic outlook here is that we have already peaked. That's my optimistic outlook, and that's based on the bad news and the good news that we're as bad as I've seen anywhere right now. The other positive thing to take from where we are now is that we've got a lot of people with hybrid immunity. We know now that natural immunity actually gives pretty good defense, and then if you get vaccinated on top of that, you're like super protected. And I think that if you're vaccinated and then you get exposed, I think you're also even more protected than if you had been vaccinated. It might even be as good as a booster shot. So I think we have a lot more people with hybrid immunity. You look at 1,500 cases potentially every day out there. A lot of those people are vaccinated too. So I think overall we're continuing to protect ourselves. We will see a booster effect once that gets out to us. I think maybe another 5 deaths as we're trending down this surge, and we still have an opportunity to continue to vaccinate people that we haven't been able to reach yet. The pessimistic outlook is that we still see cases rising. I can't see it going more than double would be shocking over the current numbers, and we may get to the point where our hospitals, one or all of them, have to ration care, 20, 30 more deaths, and maybe a pediatric death or two. That would be kind of the pessimistic outlook, which I don't think we're moving in that direction. I think that downplaying the seriousness of COVID and not trusting the data, I don't know what to say. I mean, if people have questions, true questions, and they don't know what to believe, and I think that's a big challenge. They don't know what to believe. They hear somebody that they respect and they trust saying one thing, and then they hear something on the other side from somebody else that they trust. Well, what do you do with that? And some people don't have the tools to be able to really figure out what's the right answer here and what the truth is. So, my take-home points would be, I hope you can believe that the young age groups, which are largely unvaccinated, they are driving the Delta surge in Guam. I hope that's believable, just by taking the ages of the people that are testing positive. Okay, and this has led to full hospitals that are full of both vaccinated breakthrough cases and unvaccinated. But the people that are dying are the ones that are unvaccinated, mostly. Okay, and even though we are seeing breakthrough cases, you're still more protected than being unvaccinated. So if you're not vaccinated, you're contributing to the surge. I don't know, maybe that's going to resonate. I don't know. The U.S. COVID deaths is, 9/11. I don't know, I've seen a lot of stories the past couple of days, and it's been very emotional taking yourself back to that day and that moment. And they had, close to 3,000 deaths, which was like, holy crap, 3,000 deaths. I mean, you can kind of wrap your head around that. But as the COVID deaths started getting higher and higher, it just became like, yeah, you don't even care anymore, and we've seen in the United States alone 220 9/11 deaths. That's how incredible, that's how dramatic and how many deaths that we've had. And again, you just can't even wrap your head around that. Imagine going through a 9/11 every day consecutively for 220 days. And I think that's pretty impactful. And going back to the Groundhog Day, how did Groundhog Day end? Jason knows. Jason, how did Groundhog Day end? Do you remember?
It repeated.
How did he finally break the cycle? He stopped being selfish.
Yeah.
He started caring about other people, and I think that there's a lesson there that if even though we have these personal reasons that make sense to us, and if you can trust somebody that they're telling you data that's true, and we're saying if we're all vaccinated, we're going to be better off, and if we use that, take that idea and say, let's think about each other and do this together, then maybe we can finally break out of this Groundhog Day cycle.
So there's my question for you, Doc, because and I like the phrase you used earlier, and you said there's a certain amount of the population who, because of the lack of faith in data, or they just haven't been proven. You said they haven't been swayed yet. Key elements. So do you feel as a health practitioner that the crux of the work should now be like towards education to try and get people on that on that way of thinking, because there are going to be some people, and this is a proven point, who either because of healthcare concerns or because of faith beliefs and everything like that, they just cannot. Nothing in the world is gonna allow them to do that. But for the people who have not, and I'm an advertising major, so I'm thinking of trying to encourage people to change their buying decision, if you will. So, but from a healthcare standpoint, should there be a more concerted effort to try and say, let's get the message to you to let you confidently take the vaccine?
Yeah. Well, I think that there's a selective tune out when they start hearing messages that go against what they believe. I think there are plenty of videos out there of people who are against being vaccinated, and once they're in the hospital, they're suffering and they're intubated or about to be intubated, and they say, there's plenty of videos that show them saying, I'm sorry, that's how I felt, and I wish I hadn't thought that way. Please get vaccinated. There's so many videos like that. But if you wanted to even show that to somebody who that didn't really fit what they believed, I don't think they would want to listen to or watch it. And so I think that there's going to be a selective just tuning out, even if you did try. We may not be very we may not have much chance at all to try to reach some of the people that are still holding out from being vaccinated, and I don't know what to do about that. I've had some success with some of my patients just when I find out they're not vaccinated, just to talk to them a little bit more. But that's just that's who I can influence where I am. But yeah, it's a tough question.
It is, because some people I could tell, like after the third question, I'm like, okay, I'm not trying to get into a debate here. You know what I mean? If you don't want to take it, fine, don't take it. Doc, we had one last comment. I don't know if you want to touch on this before you go. Dr. Lombard, share your thoughts on compassion fatigue.
I'm sorry?
Compassion fatigue, is that a thing?
Compassion fatigue. So I'm assuming they mean
with frontliners, probably
feeling compassionate for the frontliners,
or maybe just frontliners saying, "God, we got you guys out of this mess last year, and now you don't want to get the shot."
Yeah,
can't even with you guys.
I'm not in their shoes, and they're the ones that are really putting this on their back. And if we do things like asking if we're going to try to keep schools open, for example, if we're not going to lock down, we're basically asking the frontliners to keep doing what they're doing for as long as it's going to take, and that things might get worse. And that's a lot to ask, but perhaps that's still the least of the evils that we have to face right now, and trying to balance all of these other considerations. It's not easy. There's no easy answers here, and I think that that we do need to be mindful of what our frontliners are going through right now, and it hasn't been easy for them the past few weeks, that's for sure. I think we need to bring Dr. Uggan back on. I think we need to see in her face, what she's going through now and what she's seeing in the hospitals.
Well, that's what we're working on. Thank you, Doc. God bless you. Really appreciate it.
Thanks, guys.
All right, thanks a lot, Pete.
There you go. Yeah. When you talk about...
That was good stuff.
Yeah, it was. Guys, this is going to be one of those interviews you want to go back and watch, because he just touched on pretty much everything. All the major questions. Why are vaccinated people in the hospital? What's up with the vaccine? Is it working?
And yet there were three major bullet points, if you want to say, like takeaways and everything like that. Filter it all down to its its simplest form and everything like that. The vaccine is working. Yes, we are coming out of the tail end of vaccination. Is waning and everything like that. But if you took it, you're still substantially less susceptible from getting infected.
Yeah. So there were just a lot of points in there. He talked about the vaccine's strength really being, 1 to 2, 3, maybe up to 6 months after you take it. And so I feel like we're kind of in this real dangerous window where a lot of people are vulnerable because they took the vaccine early on, right? And that's exactly what Dr. Lombard thinks too.
We have a request here. Ira in our comments says, can someone from KUAM go to the hospital and do a report like the live report you guys did for All Rise?
Yeah, right on.
You willing to go on site again, Chris?
I'm down as long as I got 5 sets of PPEs and an astronaut helmet. All right.